Trigeminal nerve decompression technique. This is going to be useful for anyone with chronic sinusitis. It's going to help to drain fluid and ease pressure in the maxillary and frontal sinuses. For anyone with TMJ dysfunction, for facial puffiness, it's going to improve superficial lymphatic drainage of the face. For headaches, it's going to reduce tension near the nerve branches. And also for anyone with post-dental or ENT surgery, it's going to help to promote drainage. To do this technique, you're going to have the client lying in supine on their back, and you're going to be at the head of the table. You're going to palpate first the superior orbital ridge, which is just above the eye in that kind of ridge that you'll feel. Now you can use 2 to 3 fingertip pads, and then you're going to make circular motions for 30 seconds to 2 minutes. Now, after you've done that, you can move down 2 more levels. So the second level is going to be just beside the nostrils in the inferior orbital ridge. And now you're going to produce circular motions at this level for 30 seconds to 2 minutes. And once you finish that, you can move down to the final level, which is going to be along the mandible and just beside and under the mouth, under the lips. You're going to do circular motions for 30 seconds to 2 minutes.